Thanks for joining us. The power of the mind over the body. It can induce illness and it can conquer it. But only recently has the medical community begun to recognize the value of practices such as meditation in treating disease. And in America, some doctors are going as far as prescribing meditation for patients stricken with stress-related disease.
Most everyone agrees modern-day living is stressful. Every day we battle pressures which take a toll on our health and well-being. But some people have found a way to shut off this noisy, pressurized existence.
I try to think of myself really as a mountain. The idea of a mountain living and breathing is the image that sticks in my mind. If we could use a service here...
The 41-year-old businessman learned how to meditate 6 months ago. He was suffering from a painful medical condition called ulcerative colitis. His doctor told him it was aggravated by stress.
Well, I'll get that.
James didn't want to take drugs. So, at his doctor's suggestion, he instead signed up for a stress reduction program.
I have a very bright future, a company that's growing, 3 beautiful children, and I really saw that evaporating because my health was so poor.
To his initial surprise, a big part of the program involved meditation.
Being born in the 50s, that my idea of meditation was sitting in the lotus position and humming.
But James learned that his meditation would take practice and concentration to become skilled.
You don't like running around.
And he learned meditation not from a guru, but from an associate professor of medicine here at the University of Massachusetts Medical School in Worcester.
So let's now close our eyes.
The Stress Reduction Clinic at UMass was founded 14 years ago by Dr. John Kabat-Zinn. Many of the participants, like these just beginning the 8-week program, suffer from illnesses such as chronic pain or cancer or heart disease or even AIDS. All of the patients in the stress program were referred by their doctors. Dr. Kabat-Zinn says that is a clear signal of the growing acceptance of meditation techniques.
20 years ago, if we proposed a meditation-based clinic in the hospital, we would have been laughed out of here if anybody would have listened at all.
But doctors have listened. They have sent over 6,000 patients to the Stress Reduction Clinic program. The majority of them have reported that it helped them to cope with their physical or emotional problems.
Ready for a dot?
Meditation helped James Carboni eliminate the symptoms of his disease. He's had no pain or bleeding for more than 11 weeks.
Ready to come out? And I don't know the magic about it. I just know that it's working for me and that I was suffering from a disease and that it's been a remission.
Medical experts like Harvard cardiologist Dr. Herbert Benson became interested in meditation. As part of his research, Dr. Benson even went to Tibet, where he witnessed an ancient ritual. It demonstrated the potential power of the mind-body connection. Bare-shouldered monks in sub-freezing temperatures were draped with soaking wet sheets.
By actually being more peaceful and more calm in one's life and more competent at handling stressful situations without taking it to heart or having it hit you in your guts or blow the top of your head off, and I'm using these metaphors because people speak about the stress in that way, then in fact they may wind up feeling healthier, being healthier, and utilizing the healthcare system a lot less.
For many years, 57-year-old Maddie Holliday was forced to take medicine for her hypertension. Meditation is now a daily activity for Maddie.
You have to clear your mind, and you have to clear it slowly. Just let yourself go and let your body just drift into yourself. And once you do that, then you can go into deep meditation.
Maddie no longer has to take medication, not at all surprising to meditation instructor Kofi Kandwani.
We're just coming back to the idea, to the notion that maybe nature itself has built within us ways that we can heal and purify, and that we are not taking advantage of those.
Scientists say there is good evidence to suggest that the tensions of modern living contribute to many of the medical conditions we suffer. Ironically, one of the best antidotes may be found in the ancient rituals of peace and quiet.
The University of Massachusetts Medical Center is located in the New England town of Worcester. Like most busy hospitals in America, it will serve twice as many patients this year as it did 10 years ago. Despite all the powerful weapons of modern medicine, many patients can't be helped. Frustrated doctors are beginning to turn to an ancient alternative.
Episode in jail, he developed an ear infection, which just took ages and ages to set.
Across the country on the West Coast, there's an experiment with healing from within that could affect the lives of millions of women.
When you have to think as you're laying there in bed, I've got to get up and go to the bathroom. And you don't have the energy to do it. I mean, that's getting pretty basic.
I mean, they tell me that if I so much as have somebody come up to me and give me a hard bear hug, I could crack my ribs.
I just see things getting stripped away from all of us a lot of times. One thing after the other stripped away, stripped away, stripped away. And then who was left?
These women all have metastatic breast cancer, cancer that has spread throughout their bodies. Nearly 50,000 American women will die of the disease every year. A woman with this disease has approximately 2 years to live.
We used to go for a walk even. Now he doesn't go for a walk because I don't go for a walk. It affects every little tiny phase of your life. You know, there's a big empty hole.
But these women have discovered a measure of hope in a therapy that involves no new drug or experimental surgery. What's going on seems very simple.
You know, I want this so much.
They're just talking.
Can I do it? You know, what if I say yes? What if they say yes and I say yes, and a month or two down the line I can't handle it, or I die, you know? I'm going to keep it. I mean, that's really going to disappoint them.
But medical researchers are fascinated at what happens as they talk.
Oh, I'm so busy and accomplishing something.
They're all part of a remarkable study at the Stanford Medical Center in Palo Alto, California.
Make a list of maybe 3 or 4 ways of describing who you are. Take the least important of that 3 or 4, and imagine that you have to give that up.
Led by psychiatrist Dr. David Spiegel.
Just as a thought exercise, imagine that you can't be that anymore. And then the question is, who am I if I can't do that? And then maybe we could talk about that a little, what that feels like.
In 1977, Dr. Spiegel and his colleagues took 86 women with metastatic breast cancer and randomly divided them into 2 groups. One group, the control group, received standard chemotherapy and radiation. The second group received the same, with one important addition. They were asked to attend a psychotherapy support group, like this one, every week for 1 year. What Dr. Spiegel discovered, quite unexpectedly, was that the women in the support group not only felt better, they lived almost 2 years longer than the women who did not attend the group. The women who received the special treatment lived an average of 18 months longer than those who did not.
That's correct. It was a doubling of survival time from the point when the women entered the study.
That's rather remarkable, isn't it? I mean,
well, the magnitude of it was shocking to me. I even sent the paper to all of my enemies to see if they could tell me some flaw in the methodology that could account for it.
But what had you expected to find? From all over the country, people suffering from heart disease have come to a pioneering program in Oakland, California, hoping to save their lives by changing the way they live.
When it all started, oh yeah, I was feeling pretty good, and I couldn't believe they turned me down for the insurance.
That you've had a 12-year history of heart disease, is that correct?
Your first heart attack was about, what, 86?
86, 5 years ago.
Yeah, in October.
I was told at the time...
The possibility that heart disease can be reversed by changing behavior was demonstrated for the first time in a study directed by Dr. Dean Ornish. Exactly what did your study show?
Well, the coronary arteries feed the heart with blood, and over time they can get clogged up, much like rust building up in a pipe over a period of years. with cholesterol and other deposits. Now, until recently, it was thought that that process was only going to get worse over time. What our research has shown is that in the majority of patients who went through our program, the blockages could actually begin to unclog. They became less blocked. The blood flow to the heart improved, and the chest pain, as a result, diminished markedly. In our study, there was a 91% reduction in the amount of chest pain that most people had.
I lived for 3 or 4 years after my first heart attack with absolute abject denial that anything had happened. It was 2 or 3 years before I even looked at my own cardiogram, which I'm perfectly qualified to interpret. And when I did look at it, I said, yes, you had a heart attack.
What do you do for a living?
I'm a cardiologist. Right.